Thank you so much, Chair DeLauro and Ranking Member Cole, for this chance to discuss priorities I have before your subcommittee. I'm so grateful to my community for their robust engagement in our community project funding process. It was a wonderful opportunity to learn even more from my community's leaders and to better understand the needs of our region. I'm proud to have submitted 2 of these projects to your subcommittee for consideration. The first project I'd like to discuss is University Medical Center's robotics expansion. The funding for this project would be used to purchase a Da Vinci single port robot for the University Medical Center at El Paso. As the only level 1 trauma center in West Texas and as a facility that serves much of the uninsured population in El Paso, UMC is critical to the health infrastructure of the entire Paso del Norte region. As a result, acquiring the single port robot will allow UMC to improve their minimally invasive service offerings and expand their high-level medical care for everyone in El Paso, including the uninsured. It will also give the Texas Tech Health Sciences Center residents the chance to train and gain valuable clinical skills that will strengthen our future workforce. Finally, this robot will become a valuable tool in the treatment of urological cancer, a service which is currently not available in the El Paso area. The second project I'd like to bring to your attention is the La Fe Federally Qualified Health Center, FQHC, technology upgrade. Like many FQHCs in El Paso and across the country, La Fe serves incredibly vulnerable populations like the uninsured, immigrants, and more. La Fe also works in economically disadvantaged communities known as colonias, which are unincorporated areas sometimes referred to as the Forgotten America. While the work La Fe is doing is vital to our community, their technological infrastructure is in need of a complete overhaul. The funding requested for this project would do just that by interconnecting their many health services, upgrading telecommunications equipment, increasing their server capacity, and more. This overhaul would allow La Fe to act as a more effective healthcare provider and ultimately benefit those who are most vulnerable in El Paso. I'd like to now move on to 2 appropriation report language requests I submitted to the committee for consideration. The first is language urging HHS to fund the U.S.-Mexico Border Health Commission at $2 million for fiscal year 2022. The Commission is an essential organization that focuses exclusively on unique health needs and issues of southern border communities. However, during the previous administration, funding for the Commission was minimal, dropping as low as $800,000 for one fiscal year. This led to the Commission being understaffed at a point when their expertise was needed the most. If the border region is going to successfully put the pandemic in the rearview mirror, we need HHS to increase funding for the Commission so it can work to its full potential. This leads me to my next request. Since the start of the pandemic, I've been sounding the alarm about the need for a binational COVID-19 strategy. This is not a partisan issue, as I made numerous attempts to urge the Trump administration to develop a binational strategy, and I've continued to advocate for it with the Biden administration. However, we've still not seen any action to follow through on these requests. Just yesterday, we heard President Biden announce that we will be exporting 20 million more doses of vaccine to other countries. I commend the president for this action, as getting shots in the arms of as many people as possible at a global scale is important. But we've still not heard anything on whether these vaccines will be used to vaccinate Mexican border cities. Just a few weeks ago, Ciudad Juarez, which is right next to my district, had to go into lockdown for a weekend because of an increase in COVID-19 cases. The reality is that border communities like mine will not truly reach herd immunity until our Mexican sister cities also begin seeing increased vaccination rates. My final report language request would urge the U.S. section members of the Commission to engage with their Mexican counterparts to develop a binational vaccination plan so communities on both sides can return to normal. Finally, I want to emphasize with this subcommittee, as I have with other appropriation subcommittees, it is essential that you include mechanisms within your bill to guarantee that federal funding makes it to its designated recipient. In my state of Texas, Governor Greg Abbott has stood in the way of critical COVID and migrant relief funds. We need to make sure that that doesn't happen with future appropriations bills, and I urge the subcommittee to take this into consideration. Thank you so much for the opportunity to testify before you today. I look forward to collaborating with the subcommittee as you continue to draft the final appropriations bill, and I yield back.